Good morning, and thank you for inviting me for this session. My name is Nazmy Villarroel, and I'm an SPHR Post-doctoral Fellow in Public Health at the University of Sheffield. Well, my interest is focused in ethnic and migrant health, and today I would like to take you on a journey through my placement experience with the Sheffield City Council. So this placement was regarding the impact of COVID among BAME communities living in Sheffield. So the City Council contacted my mentor asking to help with the design of the COVID survey, and I applied for a placement position in order to contribute to this project. So with a population of over 500,000, the city of Sheffield is England's third largest district authority. It is an ethnically diverse city with around 19% of its population from different ethnic groups, being the largest of those groups the Pakistani community. But Sheffield is also home from people from the Caribbean, Bangladeshi origin, Somali, Yemeni, and Chinese communities. Sheffield has seen also an increased number of overseas students coming to the city and also migrant people from the European Union. So let's have a look at the numbers. What we can see here is a map of the census by population area with BAME communities, and in the darker, what you can see here, the darker areas are where the BAME population is more concentrated. So in Burngreave, the highest proportion of BAME people is up to 62%. You can see here that the BAME communities are focused in the city center, north and east parts of the city. Let's have a look at the numbers. Well, as you can see from this figure, the Pakistani community remains the largest minority ethnic group in the city, now representing around 4% of the total population. And these are figures from the census from 2011. Let's have a look at the proportions where the white groups had the highest proportion with 83.7%, followed by the Asian residents, Black residents, and mixed residents. But how this work came about? So between spring and summer, Public Health England published a report. Public Health England review, the first one on disparities in the risk and outcomes of COVID-19, was published in August 2020, and this showed that there was an association between belonging to some ethnic groups and the likelihood of testing positive and dying of COVID-19. The second report, Beyond the Data, Understanding the Impact of COVID-19 on BAME groups, showed that the highest age standardized diagnosis rates of COVID-19 were in people of Black ethnic groups. Also, people from Bangladeshi ethnicity had around twice the risk of death when compared to people of white British ethnicity. Regarding also the death rates, we found that there was a high risk between 10 and 50% among people from Indian, Pakistani, Chinese, Caribbean, and other Black ethnicity compared to the white groups. Also, when compared to other groups, the death rates for COVID-19 were higher for Black, Asian, and ethnic groups. Also, comparing to previous years, all-cause mortality was almost 4 times higher than expected among Black males for this period. Regarding women, the deaths were almost 3 times higher in this period in Black mixed groups and other females. So it is important to know that there is a pattern in which intersections between socioeconomic status, ethnicity, and racism intensify inequalities in health for ethnicity. And this demands to be vigilant in how vulnerabilities to COVID-19 by deprivation categories will disproportionately impact ethnic minorities in the UK. Due to the lack of data, local data, and on the impacts of COVID-19 by ethnic groups, it has been crucial to work in partnership with BAME communities to understand their lived experience of COVID-19 in Sheffield. Let's have a look at the socioeconomic factors. So for example, housing. The housing situation is indeed an important factor with often multi-generational and overcrowded homes. but also the structural inequalities that were already there, such as occupational risk, especially within the key workers, such as bus drivers and taxi drivers. These workers are, as we know, less likely to work from home, and those who are also self-employed had been particularly vulnerable to these situations. Well, in terms of healthcare access, some groups might be less likely to seek healthcare when needed, and this might be related to the lack of trust in healthcare services. But also, we don't need to forget that there are inequalities in prevalence of health conditions, especially in chronic conditions such as obesity, diabetes, cardiovascular disease, and asthma. So the objective of this group, taking into account the disproportionate impact of BAME community, has been compounded by long-standing and structural and health inequalities. Discrimination and racism were already there among these vulnerable communities. So the BAME Public Health Community Group was established by the Sheffield City Council to understand the lived experiences of BAME groups living in Sheffield. So I have collected the key impacts of the BAME communities. Those key impacts were collated from 25 BAME communities living in Sheffield. And I have organized in 4 main themes, which are regarding to communications, health and well-being, education, and poverty. So regarding communication, this is more focused on cultural communication. As we know, there are cultural barriers and language barriers, and accessing information regarding COVID-19 was complicated. Regarding health and well-being, as we know, mental health remains a complex subject for BAME communities, and also, issues around expressing and understanding mental health conditions had been extremely tough for these population groups. Besides, we need to take into account that many BAME groups have already lost friends and families, and this has been a significant impact among this community, especially around celebrating funerals or other religious ceremonies. It's not only the fear of loss, but also the fear of infection that we need to take into account among these BAME communities, and this had especially an impact among the elderly of this community. Regarding, well, food insecurity, this summer the Sheffield City Council had distributed more than 500 emergency food parcels, and but only 5% of these emergency food parcels has been delivered to the BAME population groups. Regarding education, well, many BAME communities have lived experience worry, stress, and sending their children to school. And this was mainly related to an increased fear of the infection, right? Regarding poverty, well, in some homes, access to technology is limited due to the poverty, being unable to afford also the equipment that they needed. And the reality is that some young people within the BAME communities have not had access to the digital technology to enable them to access educational facilities and online lessons for many communities. Finally, I will share with you some of the learning outcomes. So what we learned is that there is an important need to keep the communication with BAME communities and continue the dialogue with BAME organization to build the trust that we need to build with them. Also, the need to review and implement all recommendations within the impact assessment with robust action plans. There's a need to understand that it's important to collect local data by ethnic groups and address inequities in disease and health behaviors. It's important to involve BAME voices from the communities in the development of strategies, services, interventions, and policies, and ensure that the council services are representative and culturally appropriate and inclusive. So now to conclude, well, from my personal point of view, there are a few challenges that I had to overcome. First of all, being new to Sheffield in the middle of COVID, well, has not been ideal. I have not been able to network with the diverse organizations and NGOs that I'm used to, and this has been complicated. Regarding the placement per se, well, I think that especially when you're conducting seminars, focus groups, you know, and online, where there is always that element of lack of physical and social space, where people can get to talk to each other and get to know each other in a more familiar way. And other challenges that might arise are, as we know, tech issues or people not understanding how to open a link, etc. So now let's take this image, for example, and in my humble opinion, if you want to enjoy a beautiful view from the top of the mountain, there is no point if I tell you how hard the journey was to get there, or how long it took me to get there, or even how it felt looking at the magnificent view. I think this is a personal experience, a unique experience, and a successful journey will depend on the intention, the commitment, and the determination of the traveler. But there are a few tips that might help you with getting a good placement experience. So I would say that, you know, be proactive, build links with the organizations that are relevant to your research, find a good placement opportunity that fit your professional needs, and don't be afraid to reach out to organizations that are in line with your preferences and also with the preferences and values of the NIHR. Reach out to your existing networks in order to find what placement opportunities are out there. Understand your host's institutional needs. Do some previous research about the institution's main goals and what the work will involve. And finally, speak to your mentor about placement opportunities that might be relevant to your research. So, thank you very much. Here is my email in case you need to reach out. I'm happy to hear from you. Thank you very much.